There are more and more patients being diagnosed with this frustrating and mysterious condition, and it is Mast Cell Activation Syndrome, also known as MCAS. Hi, I'm Dr. Micah Yu, board-certified integrative rheumatologist, and today I'm going to be talking about my holistic approach and treatment to Mast Cell Activation Syndrome. There are so many different ways you can actually treat Mast Cell Activation Syndrome. You don't have to use medications alone. There are so many supplements, herbs, and other holistic approaches to MCAS. And in my clinic, I have realized that you need a combination of both to actually treat the patient. So if you haven't watched my video on MCAS with the signs and symptoms, be sure to watch it because I go in a deep dive into the signs and symptoms of Mast Cell Activation Syndrome. And I'll briefly go over them right here before I go into deep dive onto the holistic treatments. So in general, Mast Cell Activation Syndrome can affect the patient from head to toe. Starting with the brain, you can get brain fog, memory issues, heat intolerant, flushing, recurrent rashes, fast heart rate and low blood pressure. You can even have joint pain, muscle pain, nausea, vomiting, bloating, and many other symptoms. So it can be a very frustrating experience for the patient. And if you have Mast Cell Activation Syndrome, you do want to watch out to make sure you don't have hypermobility or even Ehlers-Danlos syndrome, where you can easily manipulate your joints to do things that other people cannot do, such as touching your thumbs to your wrists or even bending your pinky back past 90 degrees, or even having your elbows, when you bend it up, it doesn't go straight, it actually goes up. So these are some of the signs you do want to watch out for. And along with Mast Cell activation and Ehlers-Danlos, you can also get something called POTS or dysautonomia, where your heart rate goes really fast and it stays high for a while. So I usually look for that trifecta when I see Mast Cell Activation Syndrome. So let's talk about medications first for Mast Cell Activation Syndrome, because supplements alone, herbs alone sometimes just doesn't do it. The first medication that I talk to my patient about are something that they can just buy over the counter. It's the antihistamines, such as Claritin, Zyrtec, Benadryl. Some of these over-the-counter medications are excellent, and sometimes patients just need to take it on a daily basis in order to control their symptoms. After the over-the-counter medications, there are other medications that can be used, such as Pepcid, and sometimes taking it 20 milligrams a day is good enough for the patient. Pepcid is used for acid reflux, but it has been found to help with histamine problems. So it does help with allergic problems as well. Another medication that can be used is hydroxyzine. Hydroxyzine can also be used for MCAS. Another medication that you've probably heard before is called Singular, also known as Montelukast. Now, you gotta be careful with this medication because it can sometimes worsen depression or actually give depression as a side effect as well, but it can be used to control MCAS. Other medications that I do like to use in my patients when patients don't do well with some of these other medications is cromolyn sodium and ketotifen. Both of these are excellent medications to control MCAS. Cromolyn sodium can be taken up to 4 times a day. It could be 100 milligrams or even 200 milligrams 4 times a day. Generally, I start patients out on 1 time a day and then build up over time to see whether they have side effects to the medications or not. Some of my patients just couldn't tolerate this medication. Some of them will get more headaches, more brain fog, and also ketotifen is another excellent medication as well. You'll want to take this 1 to 2 times a day. And you can start at 1 milligram a day and then build up over time. Some patients also could not tolerate this medication, but most do. Once again, some of my patients had abdominal issues, weight gain, headaches, and brain fog on this medication. Sometimes pharmacies don't carry these medications or your insurance doesn't want to cover it. So sometimes I do send this medication to a compounding pharmacy where they can make it into any type of version of the medication that I want. If I want a tablet version, they can make it, or if I want them to make it into a liquid version, they can get that as well. Another excellent medication that I do like to use that's compounded is low-dose naltrexone. I use low-dose naltrexone in a lot of immune-related conditions, such as autoimmune diseases and allergic-like reactions, such as Mast Cell Activation Syndrome. Low-dose naltrexone is anti-inflammatory. You can only get this compounded, which means you need to go to a pharmacy that makes this from scratch. So your doctor will need to send this medication to a compounded pharmacy near you. And low-dose naltrexone can be made into any versions. So generally, you can start low-dose naltrexone at 1.5 milligrams and build up over time to 4.5 milligrams, which is the ideal dose. But patients with mast cell activation syndrome, they're very sensitive. So you will want to start off at maybe 0.5 milligrams or even less and build up over time. And with all these medications, sometimes your body just can't tolerate the excipients, which is the outer coating of the pill itself, not necessarily the medication that you're allergic to or having sensitivities to. It's the outer coating, the inactive part of the pill that makes up the outer coating of the pill itself. So you can go to a compounded medication for something such as quercetin or antihistamine so that you can absorb this in your body and take it without any reactions. And other advanced therapies are the monoclonal antibodies such as omalizumab. This is a monthly injection that you might need to take if you're having uncontrolled MCAS, even when you're taking all these different medications. Let's move on to the supplements. I love using supplements for mast cell activation syndrome. The first supplement that I do use is quercetin. Quercetin is great for allergies. It's great for the immune system. So I do like to use quercetin for MCAS. Other supplements that I do like to use are stinging nettle. I also like to use resveratrol, vitamin C, and I also like to use NAC as well, also known as N-acetylcysteine. The dose for quercetin is about 500 milligrams to 1,000 milligrams a day. Vitamin C can be taken 500 milligrams to 2,000 milligrams a day. And of course, this is not medical advice. You do need to talk to your doctor before you take any of these medications and any of these supplements, because you can have interactions with them, you might not agree with them. Your body might react to them. Even though they're just supplements, they're low risk, but you can still have reactions. And other great supplements out there are omega-3 fatty acids because they're anti-inflammatory, probiotics, prebiotics, and also vitamin D, which is crucial for the immune system. You do want to keep your vitamin D at a normal level. Some of my other favorite supplements for MCAS include the DAO enzyme, which helps break down histamine. So you do want to take this 30 minutes before meals. So if you're eating 3 times a day, then take it before your meal, 30 minutes each time before your meal. Other supplements I do like to use is phosphatidylcholine. Phosphatidylcholine is anti-inflammatory. It helps with detoxification. And I do like to use this. And there are a lot of great companies that do produce phosphatidylcholine. Phosphatidylcholine is an outer layer of your cells, and it can get damaged during inflammatory processes, which is why I like to give my patients phosphatidylcholine, because it's getting damaged during inflammatory processes, such as chronic inflammation and mast cell activation syndrome. And it's great for detoxification as well. Now, we've talked about the supplements and herbs, and we've talked about the medications. Let's talk about the root causes of mast cell activation syndrome. In my previous video, I went over the potential triggers for mast cell activation syndrome. So I want to go over them here again, because it's really important that you listen to this. So number one are foods. You want to avoid high histamine foods such as chocolate, fermented food, cheese, strawberries, dried fruit, tomatoes, shellfish, bananas as well. It doesn't mean you cannot eat these foods, you just have to be very careful with them. You also want to be careful of processed meats. It's high in histamine as well. So you generally want to stick to a low histamine diet when you have mast cell activation syndrome. Sometimes that does a trick, but sometimes it's not enough, which is where supplements and medications come in. Other triggers you want to avoid that might trigger you are certain fragrances such as air fresheners, perfumes, fragrances in shampoos, certain makeups. If you're a female or male, you want to be careful of additives in your food. Look at the coloring, make sure there's no MSG, make sure there's no extra preservatives that you can't even pronounce. And sometimes you will react to your dogs and animals because you're allergic to the fur that's causing the reactions as well. You do want to minimize any stress in your life as well, because that can trigger your mast cells, because that's part of your immune cells. So when that gets triggered, your whole system goes crazy. So there is programs out there that does limbic retraining program, which can calm your nervous system down. So if you have any trauma in the past, that can also trigger your mast cell. So limbic training programs such as the Gupta program, DNRS, or even Primal Trust can help calm down the nervous system, which can get you in the healing process with mast cell activation syndrome. Other root causes of MCAS that can trigger you is a big one called mold, or mold toxicity, or also known as mycotoxin illness. Mold exposure and having mold toxicity can trigger MCAS. And a lot of doctors overlook this because this is more of an integrative and functional medicine belief. And there are so many studies on mold toxicity. There's over 6,000 PubMed articles out there, and it can trigger MCAS. And I've seen it in my own patients, and they do have to go through treatment and be taken out of the moldy environment. So if you have any signs of a water damaged building, be very, very careful and have a mold inspector come to your house and even have it remediated afterwards as well. Other triggers of Mast Cell Activation Syndrome are insect bites, infections, chronic infections, and even Lyme disease. Lyme disease and co-infections with ticks can trigger Mast Cell Activation Syndrome. So there are times I do see my patients with mold and Lyme disease with Mast Cell Activation Syndrome. And that can be very, very tricky. You do have to sometimes treat the mold first and then treat the Lyme and calm down the Mast Cell Activation Syndrome at the same time. And that takes a very seasoned integrative doctor to navigate this difficult pathway. And as far as labs are concerned, you do want to watch my other video on the signs and symptoms because I go over the labs in that video. And if you do all these supplements, herbs, and medications, and you're still not getting better, then like I mentioned, you do want to go through a limbic retraining program so that your mind and your brain can have an easier time with the healing process, because sometimes patients have so much trauma, they've gone through so much in their life, their body's just not ready to go through the healing process because something's holding them back. And sometimes it's a limbic system that's holding them back. So you want to calm the nervous system down like I mentioned earlier. So you'll notice that you can improve over time with Mast Cell Activation Syndrome. Even if it's just a little bit at a time, over a long term, can get better. I've seen my own patients get better. I've seen my patients being misdiagnosed or even undiagnosed with MCAS. And it took me seeing this pattern over and over again with my patients because I see mystery chronic illnesses in my clinic, especially with the rheumatology conditions. A lot of patients come to me with joint pain, brain fog, fatigue, and sometimes they don't have a rheumatology condition. They actually have Mast Cell Activation Syndrome. Sometimes they actually have Lyme disease, mycotoxin illness. And it took a lot of different patients for me to start seeing this pattern in them. And sometimes they even have POTS or dysautonomia with their hypermobility syndrome. So this world of MCAS can be very tricky, but it's very treatable. And I hope you learned something about the holistic treatment to MCAS. Of course, it gets much deeper, but this is a foundation to the holistic treatment for Mast Cell Activation Syndrome. So if you enjoyed this video and you learned something today, please comment below and hit the like button. Please support my channel because I want to get this word out. A lot of people need to hear this message. And if you want to see me in my clinic, you can see me at drlifestyle.org. And as always, let's beat inflammation together because I want you to get better. I'll see you guys next time.